Kia ora koutou katoa, ngā mihi atu kia koutou I te rānei, he uri ahau no te whānau apanui Ngāti Konohi. Thank you for the opportunity to speak to you today about dental disease in young children. I am Pauline Kopu. One of my roles is as a community dentist working with Auckland DHB. And I've got apologies from Katie, who's sorry she can't be here today, but due to the large numbers of children requiring dental surgery, she was unable to get away from the hospital today. So I'm it. So I'll be briefly discussing early childhood caries, or what's more commonly known as rotten teeth in kids under the age of 6. We've chosen this population as they are our most vulnerable children who are severely affected by dental disease. This above picture is of a 5-year-old boy who required the extraction of all 20 of his baby teeth. His biggest risk factor was being frequent consumption of soft drinks. Unfortunately, this is an all too common sight in our role in the DHB. So just for a bit of background, dental caries is one of the most common chronic childhood diseases in New Zealand and is one of the most common reasons for hospital admissions for New Zealand children. Most of the children referred to the hospital require multiple fillings and extractions to be performed under general anaesthetic. Many of our children experience significant pain and infection, mostly in the form of dental abscesses, as can be seen in the picture above. Dental caries is a disease that is decreasing in most groups of the population, but unfortunately this isn't the case for preschoolers in New Zealand. So how many 5-year-olds are affected? In 2003 we see 43% of 5-year-olds in New Zealand had holes or decay in their teeth. This has increased up north in Northland to 66%, and there's a decrease in the Wairarapa to around 30%. Significant inequalities in the number of 5-year-olds with holes in their teeth are in the Greater Auckland region. You can see the spread there with Waitemata in Auckland around the 33 to 38%, and in counties Manukau 49%. This slide shows the inequality amongst population groups across New Zealand. As we can see, at the age of 5, just over 30% of Pacific children and just over 40% of Māori children are free of disease, while almost 70% of children of other ethnicities are free of disease. I've been working in the dental public health space for nearly 18 years, and this picture was pretty much the same from the day I graduated. So chronic inequality. Many of these 5-year-olds have such high levels of disease that they're unable to have their dental work performed under local anaesthetic, and they require treatment under general anaesthetic. In Auckland alone, over 2,000 children a year will require dental treatment under GA. Due to large numbers of children, there can be long waiting lists, and there are large costs to the public system. One of the more common complaints we receive at the hospital is the lengthy wait of time for treatment under GA. We literally cannot keep up with demand. While caries is a multifactorial disease, today we're focusing on dietary risk factors. The main dietary risk factor for caries in children is sugar consumption, especially when sugars are in the form of sucrose. The strongest risk factor is the frequency and form of carbohydrate intake. Children with severe levels of disease are likely to consume sugary beverages between meals. If children are fed with bottles that are filled with soft drinks or juice, this too significantly increases their caries risk. We know that children in New Zealand are consuming increasing amounts of sugar in the form of powdered drinks, cordials and soft drinks. An increased intake of soft drinks is associated with a decreased intake of dietary and other milk products. These are often protective for teeth, and this compounds the negative effects soft drinks and other sugary beverages have on young children's teeth. So what is the effect of this disease on our kids? Dental caries or rotten teeth has been shown to have significant effects on a child's oral and general health and their quality of life. Many of our kids are experiencing pain, infection, loss of sleep, restriction of foods, and missed school and play. Dental caries may also have a role to play in failure to thrive in otherwise healthy children, all from a preventable disease. This is often the end of the road for teeth affected by dental decay, with kids as young as 18 months having multiple teeth removed due to advanced dental decay. Unfortunately, these children are experiencing severe consequences of a preventable disease. Thank you all for listening.
Thank you.